शुरू अल्लाह के नाम से जो बड़ा मेहरबान निहायत रहम करने वाला है।
Assalamu alaikum. Saifullah here from Chemistry Department, University of Education, Lahore. Today the topic we are going to discuss is collection and preservation of blood sample, clinical analysis and common determination from blood serum. And the course name is Analytical Chemistry and the course code is Chem 2112. This lecture would help students to understand how to collect the blood sample from the patient, collection of COVID-19 sample from the patient, how can we preserve the blood sample, and principle of different measurement techniques such as photometric techniques. Hello everyone. Today we will discuss collection of blood. The collection of blood can be done by skin puncture. It can be done from venous blood collection. Then begin from skin puncture. Now we discuss the method of skin puncture. This method is commonly used in infants and small children, and if the amount of blood required is small. Blood obtained by skin puncture is also called capillary blood. ये मेथड हम उस वक्त जब हमने छोटे बच्चों के ब्लड का सैंपल लेना हो, ब्लड लेना हो, या एडल्ट जो हों उनमें हमें थोड़ी मकदार में ब्लड चाहिए तो हम क्या करते हैं, ये मेथड यूज़ करते हैं। अच्छा, अब ये जो हमने सैंपल लिया है इसकी कंपोजिशन टोटली डिफरेंट होती है फ्रॉम द वीनस ब्लड टिश्यूज़। अच्छा, हम ये ब्लड एडल्ट से हम किस तरह ले सकते हैं और जो छोटे बच्चे हैं उनसे हम किस तरह ये ब्लड सैंपल लेते हैं। इन एडल्ट ब्लड इज ऑब्टेन फ्रॉम द साइड ऑफ द रिंग और मिडल फिंगर और एयर लोब, बट इन इन्फेंट्स इट इज़ कलेक्टेड फ्रॉम द हील। इन विच सिचुएशन दिस मेथड इज़ हेल्पफुल। अगर हमने सेल काउंट चेक करनी हो, एस्टिमेशन ऑफ हीमोग्लोबिन और प्रिपरेशन ऑफ ब्लड फिल्म्स, कौन सा मेथड है या कैसे हम ब्लड सैंपल ले सकते हैं। द पंक्चर साइट इज़ क्लीन विद 70% ethanol. After drying, the puncture sufficiently deep to allow free flow of blood is made with a sterile dry. Now the first drop of blood is wiped away with sterile. Dry the cotton as it contains tissue fluid. Next few drops of blood are collected. After collection, a piece of sterile cotton is pressed over the puncture site till bleeding ceases. Blood should not be collected from cold, cyanosed skin, since false elevation of value of hemoglobin and red or white cells counts will be obtained. Needle size of syringe should be 19 to 21 gauge in adults and 23 gauge in children. Blood and urine samples are often collected after the patient has fasted for a period of time or overnight for cholesterol or glucose analysis. One study indicated that an average breakfast has no significant effect on concentration of blood content of carbon dioxide, chloride, sodium, potassium, calcium, urea, nitrogen, uric acid, creatinine, total protein and albumin. Serum phosphorus is slightly depressed at 45 minutes after the meal but not after 2 hours. When serum is required for analysis, the blood is collected in a clean and dry tube to prevent contamination and hemolysis. Hemolysis is the destruction of red cell with liberation of hemoglobin and other cell constituent into the surrounding fluid as serum or plasma. When hemolysis occurs, the serum is red instead of its normal straw color. A substance may occur at a much higher concentration in a cellular portion of blood than serum or plasma. If it is the concentration in the serum or plasma that is clinically significant, then hemolysis would give high serum or plasma result. As in case of potassium, iron, magnesium, zinc, urea, protein from hemoglobin and other. For this reason, blood samples should be centrifuged as soon as possible to separate serum or plasma from the cell. Caution: the collection and handling of blood and other biological samples requires great care because of possible presence of disease such as HIV or AIDS. We should use gloves. Rubber gloves must avoid डायरेक्ट कंटेक्ट ऑफ ब्लड ऑफ पेशेंट. इस तरह जब हम अगर कोई पेशेंट है कोविड-19 उसका ब्लड सैंपल लेना चाहते हैं तो हमें किट्स लाजमी इस्तेमाल करने चाहिए, ग्लव्स पहनने चाहिए और वरना वो इन्फेक्शन हमें भी हो सकता है. Blood is never collected from an intravenous line or from the arm being used for intravenous line since it will dilute the blood sample. Tourniquet should not be too uptight and should not be applied for more than 2 minutes as it will cause hemoconcentration and alteration of test result. Puncture site should be allowed to dry completely after cleaning with alcohol before performing the venipuncture. Tourniquet should be released before removing the needle from the vein to prevent hematoma formation. To avoid hemolysis, the blood is withdrawn gradually and the needle is detached from the syringe before dispensing blood into the container. All the blood samples are considered as infectious and proper precautions should be observed while collecting blood either from a vein or a skin puncture.
COVID-19 diagnostics. Performing a nasopharyngeal or oropharyngeal swab. It is essential to follow proper infection control measures when samples are collected from patients with a suspected coronavirus infection. Among other things, the examiner should wear an N95 respirator mask, gown, protective goggles, and gloves. To save resources, we will refrain from using each of these items in this video and instead only show the technical details of sample collection. Let's begin with the nasopharyngeal swab. The patient should be alert and cooperative. Allow them to first blow their nose. The patient should sit in a relaxed and comfortable position during the sample collection process. Tilt the patient's head back slightly and support it with your non-dominant hand. If necessary, lean the patient's head against a wall to minimize jerky movements. Stand slightly offset from the patient to avoid the risk of contamination in case of a sudden cough or sneeze. Be sure to advise the patient of potential discomfort during sample collection and let the patient know that they are welcome to close their eyes. Sample collection should only be completed using sterile swabs made from artificial cotton with flexible plastic shafts. Calcium alginate swabs or swabs with wooden shafts must not be used. These materials can inactivate viral particles or inhibit PCR tests. Furthermore, wooden shafts are more likely to cause patient injury. Hold the swab like a pen between the thumb, index, and middle fingers. Maintain a loose grip that allows the swab to accommodate any resistance encountered during sample collection to reduce the risk of injury. Avoid using the following hand position during sample collection. Start by inserting the swab horizontally into the left or right nostril. Carefully advance the swab while maintaining a course that is close to both the septum and the floor of the nose, parallel to the palate. Do not advance the swab upwards, but instead straight back until resistance is felt as the swab reaches the posterior nasopharynx. When collecting samples from an adult patient, this corresponds to a travel distance of approximately 5 to 6 centimeters or 2 inches. Leave the swab at this depth for a few seconds while gently wiping the wall by twisting the swab shaft. Slowly and gently remove the swab. Immediately insert the swab into the sample collection tube, which may contain 2 to 3 milliliters of viral transport media. If a nasopharyngeal swab cannot be collected for any reason, an oropharyngeal sample can be also collected through the mouth. Again, inform the patient that the smear will feel uncomfortable for a short time and may trigger a gag reflex. Ask the patient to open their mouth wide, protrude their tongue forward, and say "ah." Depress the patient's tongue using a tongue depressor. Gently insert the swab into the oral cavity without touching the lips, teeth, tongue, hard palate, or soft palate. These surfaces should be avoided as they are often colonized by a wide range of microbes. Collect the sample from the back wall of the throat. Twist the swab shaft gently but thoroughly, sampling the oropharyngeal wall. Just as with the nasopharyngeal swab, the oropharyngeal swab should now be placed into the sample collection tube and sent to the laboratory as quickly as possible.
Now we discuss the preservation of blood sample. If the plasma or whole blood is required for analysis, then the blood is collected in a tube containing an anticoagulant. What is anticoagulant? An anticoagulant is a chemical substance that prevents clotting of blood. In daily laboratories, we use EDTA or TSC as anticoagulant, and they provide 4 hours to 1 day preservation of blood component in normal state. In blood bank, we use to store a blood for a long time, so that we need some special types of anticoagulant. There are many examples of anticoagulant which are used in blood bank for preservation of blood sample. First is citrate, which is chelate calcium, thus prevent blood clotting. Citric acid, which prevent the caramelization of glucose during autoclave. Sodium dihydrogen phosphate, which act as a buffer. Saline, act as acetonic solution for red blood cell. Dextrose, act as nutrients or ATP production. Adenine, substrate for ATP synthesis. Mannitol, act as sugar, reduce hemolysis and increase the life of blood. Protein-free filtrate. Protein-free filtrate increase the stability of sample. Protein-free filtrate can be prepared as 1 volume of blood or plasma is mixed with 7 volume of water, then and 1 volume of 3 molar sulfuric acid, and then color become brown. Then add 1 volume of 10% sodium tungstate is added, and after 2 minutes the precipitate protein is separated or centrifuge. Another method, which is TCA, trichloroacetic acid. In this method, 1 volume of blood, serum or plasma is mixed with 9 volume of 5% TCA, and after protein are precipitated, the mixture filter. Both of these yield acidic filtrate. The glucose can be analyzed by being oxidized with alkaline copper tartrate. Glucose is a stable in protein-free filtrate because the glycolytic enzyme are removed. A protein-free filtrate is sometimes needed to prevent matrix interference from the protein. A protein-free filtrate is prepared with barium hydroxide and zinc sulfate. Removes most interfering non-glucose reducing substance. This provides essentially a neutral a protein-free filtrate because the zinc hydroxide product is precipitated. Why protein-free filtrate is very necessary? Before performing any test, the student need to know that why a certain test is performed. Without knowing the reason for test, we might see student lack of interest. When students have no idea what is doing, that why I am going to explain why in this test conducted. There are many blood carried out in lab and many of them can be performed well. If protein is present in the blood, protein has tendency to interfere with many things during these tests and that's why removing it from blood is very necessary. That is the reason protein-free filtrate tests are performed, including precipitation by ion. There are different methods used for determination of serum electrolyte, such as atomic absorption spectrophotometry, flame photometry, ultraviolet spectrophotometry, and last one is the calorimetric method. The principle of spectrophotometry. It is a method to measure how much a chemical substance absorbs light by measuring the intensity of light as a beam of light passes by a sample solution. The basic principle is that each compound absorbs or transmits light over a certain range of a wavelength. Atomic absorption spectrophotometry is a technique uses basically the principle that free atom generated in a atomizer that can absorb radiation at a specific frequency. Principle of flame photometer is based on measurement of emitted light intensity when a metal is introduced into the flame. The wavelength of color gives information about the element and the color of flame gives the information about the amount of element present in the sample. There are different applications of flame photometry. Determining the concentration of sodium and potassium ion in an infused solution such as NaCl solution, Ringer solution or others. Product control and indirect quality testing of various substances over a sodium, potassium or lithium. Concentration determination in a pharmaceutical reagent. In flame photometer, generally natural gas is used as a fuel and air is the oxidant. Spectrometry, particularly in the visible region of electromagnetic spectrum, is one of the most widely used methods of analysis. It is very widely used in clinical chemistry. Measurements can be made in the infrared, visible and ultraviolet region of spectrum. The wavelength region of choice will depend upon the factors such as availability of instrument, whether the analyte is color or can be converted to a color derivative, whether it contains functional group that absorb in the ultraviolet or infrared region. Infrared spectrometry is generally less suitable for quantitative measurement but better suited for qualitative or fingerprint information than are ultraviolet and visible spectrometry. Visible spectrometers are generally less expensive and more available than ultraviolet spectrometer. Fluorescence spectrometry is a technique in which the amount of light emitted upon excitation is related to the concentration. This is an extremely sensitive analytical technique. Clinical analysis procedures based on electrochemical sensor. There are different blood gases such as oxygen, carbon dioxide, electrolytes such as calcium, potassium, zinc, manganese, and metabolites, DNA, antibody-antigen complex are separated from the sensing substrates such as semi-permeable membrane, ionophore, enzyme, single-strand DNA, antigen, antibody complex, and different techniques such as electrochemical measurement as potentiometric, amperometric method used in clinical analytical parameters for analysis of blood or serum to determine the different substance present in the blood. Clinical analysis and common determinations. The major serum electrolytes as sodium, potassium, calcium, magnesium, chloride, and bicarbonate are easy to determine. The metals are most readily determined by the use of flame spectrophotometric or atomic absorption method. Although colorimetric method exists for calcium and magnesium less frequently. Magnesium are also titrated with EDTA. Iron selective electrodes are used for the routine analysis of sodium, potassium, and calcium. Bicarbonate is analyzed also by titration against standard acid. Chloride is widely determined by automatic colorimetric titration with electrogenerated silver ion. Blood glucose and blood urea nitrogen are probably the two most frequently performed clinical tests. Uric acid is more specifically determined enzymatically than by described method. The uric acid is a separate aliquot of a sample is destroyed with the enzyme uricase and decrease in the blue phosphotungstate reduction product is measured. This second aliquot effectively serves as a blank. The uric acid may also be measured directly by its absorbance in the ultraviolet region at 290 nanometer before and after incubation with uricase. Albumin and globulin are analyzed by the same procedure as so far total protein after fractionation by salting out with either sodium sulfate or sodium sulfide. More detailed information may be required about the protein fractionate, alpha, beta, or gamma globulins, in which case starch gel electrophoresis can be used to separate the proteins. Microanalysis of protein is used when highly accurate data are required. The burette method is accurate to about 4%. Acid and alkaline phosphatases are enzymes contained in blood and are active in acid and alkaline solution. Respectively, the substance used for their analysis is sodium glycerophosphate
At appropriate pH, these enzymes hydrolyze the substance to release phosphate. Other phosphate substrates can be used. A number of tests are also performed with urine sample, and frequently the same procedure can be used. Because of different concentration and interference, modification in the procedures may be introduced. Analyses are unusually performed with 24-hour sample, that is, urine collected over a 24-hour period. Since the total daily excretion of most substance has much more significance than the concentration in a random sample. There are different substances which are determined by blood or serum by different spectrophotometric method or different techniques such as barbiturates, uric acid, urea nitrogen, sugar, glucose, sodium, protein bound iodine, protein total, potassium, phosphatase, alkaline, inorganic, phosphatase, acid, non-protein nitrogen, iron, creatinine, chloride, carbon dioxide, calcium, and barbiturates are these substances which are determined by different methods. Now we discuss the procedure used in clinical analysis of barbiturates. Substance which are determined as barbiturate, sample analyzed which is serum, measurement method is ultraviolet spectrophotometry. Principle: extract barbiturates in CHCl3, back extract into sodium hydroxide solution and measure the ultraviolet absorption at alkaline pH at 252 nanometer. Now we discuss the barbiturates. Barbiturates को हम उर्दू में इस तरह कहते हैं, ये सकून और अद्वियात हैं. A barbiturates is a drug that act as a central nervous system depression and can therefore produce a wide range of effects from mild sedation to death. Barbiturates are effective as hypnotics and anticonvulsants but have physical and physiological addiction potential as well as overdose potential among other possible adverse effects. Barbiturates, which are drugs not normally present in the blood, are extractable or unionized from blood into methylene chloride. They can be back extracted into 0.45 molar sodium hydroxide as a ionized form. The ionized form absorbs in the ultraviolet region where the non-ionized form does not. Plotting an absorption spectrum can qualitatively confirm the presence of barbiturates. The ionized form at pH 13 to 14 present an absorption maximum between 252 and 255 nanometer, with a range minimum between 234 and 237 nanometer, and at pH 9.8 to 10.5 are different ionized form exhibit a maximum at 240 nanometer. Creatinine substance determined is creatinine, sample analyzed serum, measurement method is spectrophotometer. Principle: protein free filtrate reacted with alkaline picrate and absorbance measured at 490 nanometer. Spectrophotometric measurement in the visible region or ultraviolet region are widely employed in clinical chemistry, frequently by forming a derivative or a reaction product that is colored and can be related to the test substance. For example, creatinine in the blood is reacted with picrate ion in alkaline solution to form a color product that can absorb at 490 nanometer. Iron is reacted with bathophenolphthalein and measured at 535 nanometer. Now we discuss the what is creatinine blood test. A creatinine blood test measures the level of creatinine in the blood. Creatinine is the waste product that forms when creatine, which is found in your muscle, breaks down. Creatinine levels in the blood can provide your doctor with information about how well your kidney are working. Uric acid sample analyzed from serum. Measurement method is spectrophotometry. Principle: tungstic acid protein free filtrate oxidized with alkaline phosphotungstate and measure the blue reduction product of phosphotungstate at 380 nanometer. Urea nitrogen sample analyzed by blood. Measurement method is spectrophotometry. Principle: tungstic acid protein free filtrate incubate with urease enzyme at pH 6.8 to produce ammonia. Determine the ammonia with Nelser reagent. Phosphatase sample analyzed serum. Measurement method is spectrophotometry. Principle: incubate with sodium glycerophosphate for 1 hour at pH 4.9 to liberate phosphate. Determine the phosphate as with inorganic phosphorus. Potassium sample analyzed serum. Measurement method: flame photometry or electrode. Dilute 1:50 with 0.15 molar NaCl and measure at 766 nanometer potassium ion. Protein bound iodide sample analyzed serum. Measurement method is spectrophotometry or catalytic. Precipitate protein with TCA ash or digest the protein and measure the catalytic effect of iodide. Now we discuss the protein separation from the blood. As substance determine which is protein, sample analyzed is serum. Measurement method is spectrophotometry. Principle: burette reagent form a complex with protein. Measured absorbance at 550 nanometer after 30 minutes. Spectrophotometric methods are used to monitoring of many enzyme reaction by following the change in absorbance. At 340 nanometer, due to changes in the reduced form of nicotine amide adenine dinucleotide, NADH is a common reactant or product in an enzyme reaction. Student assignment. First is biosensor. Define the biosensor and what are the application of biosensor in the Pakistan. What are the serum electrolytes and discuss its different application and uses. Define the anticoagulant and its importance. What is the importance of kits during collection of blood from the patient? Reference Christian GD book, Harris DC and Skoj DA. References: there are many books such as GD Christian Analytical Chemistry and Skoj Fundamental of Analytical Chemistry 2013 9th edition.